Before accepting that HyProCure is the best solution for hyperpronation, it's only natural to explore other options. So, are there other methods or corrective devices available to treat these issues? The answer is yes. Possible treatment options include orthotics, leg braces, reconstructive surgery, as well as implants. However, each of these treatments fails the patient in one way or another. Orthotics don't correct the obliteration of the sinus tarsi. They're not always covered by insurance. They won't fit in all shoes. They aren't a solution for everyone, and they can actually worsen the problem. Leg braces are cumbersome. They can cause nerve damage, and excessive internal motion still occurs. Reconstructive rear foot surgery is incredibly invasive, has extremely extensive recovery, can result in complications, and the results are unpredictable. Finally, we come to subtalar arthroresis. This surgery is minimally invasive, completely reversible, and provides internal correction of hyperpronation. Subtalar arthroresis is the best modality to treat excessive motion of the rear foot. Instead of restricting motion from the outside, subtalar arthroresis corrects the problem at the source, acting as an internal orthotic, restoring the normal joint motion. However, at this point, you still have multiple options available. There are two classifications of arthroresis devices: intraosseous and extraosseous. Intraosseous devices require a hole to be drilled into the calcaneus, which can create problems down the road. In addition, the actual implant is composed of a polymer, so it will eventually disintegrate in the patient's foot, requiring another surgery. Furthermore, these implants only work for pediatric patients, a small portion of the population affected by this condition. Extraosseous devices are inserted into the sinus tarsi, where soft tissues naturally hold them in place. There are two types of these devices. Type 1 implants are inserted into the sinus portion of the sinus tarsi and come in a variety of sizes and materials. These devices are designed to prevent obliteration of the sinus tarsi by blocking the talus from moving. Although this works in theory, the talus smashes against the device and it is pushed into the floor of the calcaneus, causing damage to these bones over time. Furthermore, these implants are not anatomical. Therefore, they're difficult to position inside the sinus cavity and can cause future complications. Lastly, fitting the proper size requires the insertion of several implants and usually results in a traumatic experience for the patient. This brings us to the Type 2, HyProCure, the only solution available of its kind. This device is inserted into both the sinus and canalus portions of the sinus tarsi, thus preventing obliteration while still allowing the normal triplane motion. HyProCure is a lifelong solution, correcting the problem for anyone over the age of 3. Once placed, the talus glides over the stent, creating no friction or stress on the bone. HyProCure is self-seating, recreates normal triplane motion of the talus on the calcaneus, will last the life of the patient who is any age, and it can be inserted with minimally invasive surgery. It's the perfect solution. There is a difference in treatments. That difference is HyProCure, changing the way the world walks, one foot at a time.